Right now, millions of older adults are taking medications that could be silently destroying their hearts. And here is the shocking part: these are not illegal substances or experimental treatments. These are common drugs sitting in medicine cabinets across the world. Drugs that doctors prescribe every single day. A growing number of cardiac surgeons and cardiologists are now sounding the alarm. They're seeing patterns in their operating rooms that they cannot ignore. Hearts that should be relatively healthy for a patient's age are showing damage that seems almost impossible. Inflammation markers are through the roof. Heart muscle is weakened. Rhythm problems are appearing out of nowhere. And when they trace back the medical histories, they keep finding the same culprits over and over again. The research is finally catching up to what these surgeons have been witnessing firsthand. Major studies from institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology are now confirming what many suspected. Certain medications that millions of older adults take regularly are causing measurable documented heart damage. We are not talking about rare side effects that happen to 1 in 1 million people. We are talking about significant cardiovascular risks that affect substantial percentages of users. Some of these drugs increase heart attack risk by over 40%. Others double or even triple the chances of developing dangerous heart rhythms. And the most alarming part is that many patients have no idea they are at risk. But there is one drug on this list that stands above all the others. One medication that cardiac surgeons are now calling the silent heart killer. The research on this particular drug is so alarming that some experts believe it should carry a black box warning, specifically for older adults. A massive study involving over 500,000 patients found that this drug was associated with catastrophic cardiac outcomes. And the worst part is that alternatives exist that are far safer. But before we reveal that number one drug, let me walk you through the complete list so you understand the full picture of what could be damaging your heart right now. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment. So drop your comments below. Now, without any further ado, let's get started. Medication number seven, proton pump inhibitors. You probably know these drugs by brand names like Pylock, Nexium, and Previsit. Proton pump inhibitors, commonly called PPIs, are among the most prescribed medications on the planet. They work by reducing stomach acid production, which helps with acid reflux, heartburn, and ulcers. For short-term use, they can be incredibly helpful. The problem is that millions of older adults have been taking them for years or even decades, and the heart-related consequences are now becoming impossible to ignore. A landmark study published in the journal PLOS examined data from nearly 3 million patients. The researchers found that PP users had a 16 to 21% increased risk of heart attack compared to non-users. That number might not sound dramatic at first, but when you consider how many people take these drugs daily, we are talking about hundreds of thousands of additional heart attacks that could potentially be linked to PP use. The mechanism behind this damage is fascinating and terrifying at the same time. PPIs appear to reduce the production of nitric oxide in the cells that line your blood vessels. Nitric oxide is absolutely critical for cardiovascular health. It keeps your blood vessels relaxed and flexible. It prevents blood clots from forming. It protects against inflammation. When nitric oxide levels drop, your arteries become stiffer. Blood pressure rises. The risk of dangerous clots increases dramatically. Another study from Stanford University found that PPIs were associated with a doubled risk of cardiovascular mortality in patients with coronary artery disease. The researchers were so concerned by their findings that they recommended physicians reconsider long-term PP prescriptions, especially for older adults with existing heart conditions. The good news is that many people can manage their acid reflux with lifestyle changes and safer alternatives. Losing excess weight often dramatically reduces acid reflux symptoms. Eating smaller meals and avoiding food within 3 hours of bedtime helps enormously. Elevating the head of your bed by 6 uses gravity to keep acid where it belongs. For those who still need medication, H2 blockers like Photodyne appear to be much safer for the heart while still providing meaningful acid reduction. But this is just the beginning of our list, and the cardiac risks get significantly more serious from here. Number 6, certain medication. Number 6, antibiotics. This one catches most people completely off guard. Antibiotics save lives. They are one of the greatest medical discoveries in human history. But certain classes of antibiotics have now been conclusively linked to serious heart problems in older adults. The biggest offenders are fluoroquinolones, which include drugs like cipraloxacin, levofloxacin, and moxifloxacin. You might know these by brand names like Cipro, Levaquin, and Avelox. A major study published in the Journal of the American College of Cardiology analyzed data from over 7 million patients. The researchers found that current fluoroquinolone use was associated with a 66% increased risk of aortic aneurysm and dissection. That is when the main artery in your body develops a dangerous bulge or tear. This is often a fatal event. The study found that this elevated risk persisted for about 60 days after taking the medication. But the cardiac dangers do not stop there. Fluoroquinolones can also cause a condition called QT prolongation. This is a change in the electrical activity of your heart that can lead to dangerous irregular rhythms. In some cases, it triggers a potentially fatal arrhythmia called torsades de pointes. A study in the New England Journal of Medicine found that the risk of serious cardiac arrhythmias was significantly elevated in patients taking these antibiotics, particularly those over 65 years old. The FDA has issued multiple warnings about fluoroquinolones over the years. They now recommend that these antibiotics should only be used when absolutely necessary and when safer alternatives are not available for simple infections like uncomplicated urinary tract infections or sinus infections. Older and safer antibiotics are usually just as effective. Drugs like amoxicillin, trimethoprim, sulfamethoxazole, or nitrofurantoin do not carry the same cardiac risks. If your doctor prescribes a fluoroquinolone, it is absolutely reasonable to ask whether a safer alternative would work for your specific infection. The next drug on our list is one that millions of older adults take for pain relief, often without realizing the cardiac danger they are putting themselves in. Medication number 55, nonsteroidal anti-inflammatory drugs. ZADs are everywhere. Ibuprofen, naproxen, Cioxib, and dozens of other medications fall into this category. Brand names like Advil, Motrin, Ali, and Celra are household names. These drugs are phenomenal at reducing pain and inflammation. For younger people using them occasionally, the risks are minimal, but for older adults who take them regularly for chronic conditions like arthritis, the cardiac consequences can be devastating. A comprehensive meta-analysis published in The Lancet examined data from over 350,000 patients across multiple studies. The findings were striking. High-dose NSAIDs increased the risk of major cardiovascular events by about one-third. The drug Cioxib, marketed as Celebert, increased heart attack risk by 37%. Ibuprofen increased the risk by 44%. And diclofenac, which is less common in the United States, but widely used elsewhere, increased the risk by a staggering 41%. The mechanism involves multiple pathways. NSAIDs block enzymes called sialoins, which are involved in producing substances called prostaglandins. Some prostaglandins protect the heart and blood vessels. When you block their production, you shift the balance toward increased clotting, higher blood pressure, and more inflammation in the arteries. NSAIDs also cause the body to retain sodium and fluid, which raises blood pressure and puts additional strain on the heart. A study from Denmark followed over 1 million patients and found that even short-term NSAID use was associated with increased cardiovascular risk. The risk started climbing within the first week of use. This finding completely overturned the assumption that brief NSA courses were safe for everyone. The safest approach for older adults dealing with chronic pain is to explore alternatives whenever possible. Acetaminophen, which is Tylenol, does not carry the same cardiovascular risks, though it has its own concerns with liver function. Topical NSA applied directly to painful areas deliver much less drug systemically and appear to be safer for the heart. Physical therapy, weight management, and targeted exercises can often reduce the need for pain medications altogether. What comes next on our list is a medication that cardiac surgeons particularly worry about because so many older adults depend on it. Number 4, certain diabetes medication. Number 4 medications. Diabetes dramatically increases the risk of heart disease on its own. That is why the choice of diabetes medication matters enormously for cardiovascular health. Not all diabetes drugs are equal when it comes to the heart. Some newer medications actually protect the heart, but older diabetes drugs, particularly some that are still widely prescribed, have been linked to increased cardiac risk. The Silanura class of diabetes medications has been under scrutiny for years. Drugs like glyride, Gliazide, and Glimperiod fall into this category. They work by forcing the pancreas to release more insulin. A major study published in Circulation. Cardiovascular quality and outcomes followed over 250,000 diabetic patients. The researchers found that Solanura use was associated with a 20% increased risk of cardiovascular death compared to metformin use alone. Another study in diabetes care found that glyride specifically was associated with a significantly higher risk of heart attacks compared to other diabetes medications. The problem with sulfonylureas involves several mechanisms. These drugs can cause low blood sugar, which triggers stress hormones that are hard on the heart. They may also affect potassium channels and heart muscle cells, potentially making the heart more vulnerable to dangerous rhythms during times of stress. Some researchers believe they may actually accelerate the progression of atherosclerosis, which is the buildup of plaque in arteries. The contrast with newer diabetes medications is remarkable. Sigil-2 inhibitors like empaglin and dapagliflozin have been shown in large clinical trials to actually reduce the risk of heart failure and cardiovascular death. GLP-1 receptor agonists like semaglutide and liraglutide similarly show cardiovascular benefits. If you are an older adult taking a sulfonylurea for diabetes, this is absolutely worth discussing with your doctor. The goal of diabetes treatment is not just to lower blood sugar numbers on a lab test. It is to prevent the complications of diabetes, with heart disease being the most deadly. The next medication on our list has been controversial for years, and the cardiac concerns continue to mount. Medication number 3, certain sleep medications. Sleep problems plague older adults. Nearly half of people over 65 report difficulty sleeping. The temptation to reach for a sleeping pill is completely understandable. But certain sleep medications have been linked to serious cardiovascular consequences that make insomnia seem like the lesser problem. Z-drugs like Zolpidem and Isopicone are among the most commonly prescribed sleep aids. You know these as Ambient Sonata and Lunesta. A large study published in BMJ Open examined over 30,000 patients taking these medications. The researchers found that hypnotic sleep aids were associated with a 4.5 times greater risk of death compared to matched controls who did not take these drugs. Cardiovascular events were among the leading causes of these excess deaths. The mechanisms are not entirely clear, but researchers have identified several possibilities. These drugs suppress respiratory drive, which can worsen sleep apnea. Sleep apnea is a major risk factor for heart disease, high blood pressure, and stroke. By making sleep apnea worse, these medications indirectly increase cardiac risk. Additionally, these drugs are associated with falls and injuries, which are extremely dangerous for older adults with heart disease. The stress of hospitalization from a fall can trigger heart attacks and other cardiac events. Benzodiazepines like Taspam, Lorazepam, and Diazepam carry similar concerns. A study in the journal Sleep found that benzodiazepine use in older adults was associated with increased mortality from cardiovascular causes. These drugs also tend to cause grogginess and cognitive impairment the next day, which increases fall risk further. Better approaches to insomnia exist. Cognitive behavioral therapy for insomnia called CBTI has been proven in clinical trials to be more effective than sleeping pills for long-term sleep improvement. It works by addressing the underlying thoughts and behaviors that perpetuate insomnia. Good sleep hygiene practices make an enormous difference. Keeping a consistent sleep schedule, avoiding screens before bed, keeping the bedroom cool and dark, and limiting caffeine to early morning hours all help tremendously. For those who still need occasional sleep support, Melatonin at low doses appears to be much safer than prescription sleep aids. We're getting close to the most dangerous drugs on this list, and the next one might surprise you. Number 2, certain medication number 2 antipsychotic medications. Antipsychotic medications are sometimes prescribed to older adults for agitation, behavioral problems associated with dementia, or psychiatric conditions. The use of these drugs in older adults has grown substantially over the past 2 decades, and cardiac surgeons are increasingly seeing the consequences in their patients. A landmark study published in the New England Journal of Medicine examined over 44,000 elderly patients taking antipsychotic medications. The findings were deeply concerning. Patients taking these drugs had a roughly double the risk of death compared to non-users. The excess deaths were primarily from sudden cardiac causes. Both typical antipsychotics like calopidol and atypical antipsychotics like risperidone, palenzapine, and quapine were associated with increased risk. The cardiac mechanisms involve multiple pathways. These drugs can cause acute prolongation, that dangerous change in heart rhythm we discussed earlier. They also cause metabolic changes that increase heart disease risk, including weight gain, elevated blood sugar, and unfavorable cholesterol changes. Some antipsychotics block alpha adenuric receptors, which causes sudden drops in blood pressure when standing up. This is called orthostatic hypotension. It can lead to falls, fainting, and in some cases, sudden cardiac events. The FDA has issued black box warnings about the use of antipsychotics in elderly patients with dementia-related psychosis. These warnings state that antipsychotics are associated with increased risk of death in this population. Despite these warnings, off-label use of these medications in nursing homes and other care settings remains disturbingly common. Safer approaches for managing agitation and behavioral symptoms in older adults do exist. Identifying and treating underlying causes like pain, infection, or medication side effects often resolves behavioral problems without antipsychotics. Environmental modifications like reducing noise and confusion, maintaining consistent routines, and ensuring adequate lighting can help tremendously when medications are truly necessary. Starting with the lowest possible dose for the shortest possible time minimizes cardiac risk. And now we arrive at the number 1 drug on this list. The one that cardiac surgeons say poses the greatest threat to the hearts of older adults. Number 1, certain prescription pain medications. Opioid pain medications represent the single greatest pharmaceutical threat to the hearts of older adults, according to multiple cardiac surgeons and cardiologists interviewed for this report. We are talking about drugs like medication no. 0.1 oxycodone, hydrocodone, morphine, fentanyl, and tramadol. Brand names include OxyContin, Vicodin, Percoet, and many others. These drugs are tremendously effective at relieving severe pain. In appropriate circumstances, they serve a valuable medical purpose, but their impact on the cardiovascular system of older adults is now undeniable. A massive study published in the Journal of the American Heart Association analyzed data from over 575,000 patients over the age of 65. The researchers found that long-term opioid use was associated with a 65% increased risk of cardiovascular death. That number is staggering. Another study in JAMA Internal Medicine found that opioid initiation in older adults was associated with more than double the risk of cardiovascular events in the first 30 days of use. The mechanisms underlying this cardiac damage are numerous and severe. Opioids cause respiratory depression, meaning they slow and weaken breathing. This leads to lower oxygen levels in the blood, which stresses the heart tremendously. During sleep, when LPUD effects are strongest, oxygen levels can drop dangerously low. This triggers inflammatory responses and oxidative stress that damage blood vessel walls and heart muscle over time. Chronic opioid use has been shown in studies to cause changes in heart structure and function that resemble the changes seen in heart failure. Opioids also affect the autonomic nervous system, which controls heart rate and blood pressure. Long-term use appears to disrupt the normal balance of this system, making the heart less able to respond appropriately to stress. Studies have shown that opioid users have reduced heart rate variability, which is a marker of cardiovascular health. Low heart rate variability is associated with increased risk of sudden cardiac death. The immune system effects of opioids add another layer of cardiac risk. These drugs suppress immune function in ways that may promote the development and progression of atherosclerosis. Research has shown that opioid users have higher levels of inflammatory markers associated with heart disease. They also appear to have accelerated plaque buildup in their arteries compared to non-users. Perhaps most concerning is the interaction between opioids and other medications that older adults commonly take. Opioids combined with benzodiazepines create a particularly dangerous cocktail. Both drugs suppress breathing, and together the effect is amplified. Opioids combined with heart rhythm medications can worsen QT prolongation. Opioids combined with blood pressure medications can cause dangerous drops in blood pressure. The path forward for older adults dealing with chronic pain is challenging, but absolutely possible. Pain management specialists now emphasize multi-modal approaches that combine multiple non-opioid strategies. Physical therapy addresses underlying mechanical problems that cause pain. Interventional procedures like nerve blocks can provide targeted relief without systemic drug effects. Cognitive approaches help patients develop skills for managing pain without constant medication. For older adults currently taking opioids for chronic pain, gradual tapering under medical supervision is often possible. Many patients find that their pain actually improves as they reduce opioid doses because these drugs can paradoxically increase pain sensitivity over time through a mechanism called opioid-induced hyperalesia. The cardiac surgeons sounding this alarm are not telling older adults to throw away their medications without discussion. What they are urging is informed conversation with healthcare providers about cardiac risks. Many older adults take medications that seemed reasonable when prescribed, but now carry known heart risks that were not fully understood at the time. The research has evolved. The understanding has deepened. And patients deserve to know what that research shows so they can make informed decisions about their own health and their own hearts. The heart damage from these medications is often preventable, but prevention requires awareness. It requires conversation, and it requires a willingness to explore safer alternatives when they exist. Here is something I am really curious about. After watching this video, are you planning to have a conversation with your doctor about any medications you are currently taking? Or do you feel like bringing up these concerns might damage your relationship with your healthcare provider? I want to know what is holding you back or pushing you forward, because this conversation matters more than most people realize. Now, we want to hear from you. Are you or someone you know currently taking any of these medications? Have you noticed any unexpected heart symptoms or changes since starting them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.